It seems like no matter how you slice it, you have some people in Congress, primarily populating the Democratic Party, that are looking to expand Medicare for all and basically making the system more one size fits all, versus those that want to sort of cut out the middleman, whether it's your employer or whoever it is that's sort of dictating your choices and forcing you to buy things you don't need. Is there is that change simple? And what I'm trying to ask is, do we need a big healthcare overhaul to get to patient choice, or is there a simple sort of opt-out thing that is less scary to people who are so tired of people monkeying with their access to healthcare? Do we have to do a big thing? Do we have to get 60 votes for a big thing? I don't know the answer to this, but I've always been looking for those like easy things that are really based on individual choice, that sort of let people opt out.
Yeah. Well, I think the problem is that a lot of conservatives latch on to policy ideas that are good policy ideas, but they think of them as kind of the panacea for how to solve healthcare. So, for example, price transparency is one of those. The Trump administration and also the Senate Help Committee did a lot of great things in the past several years on increasing the transparency around healthcare services and the prices that patients pay for them. But the problem with that is that 80%, if you have an employer-sponsored plan, 80% of your healthcare costs are paid by your employer and through the insurer still, and you're only paying about 20%. And so once you hit your deductible every year, it doesn't matter. You don't have to price shop anymore for the most cost-convenient service. And so we have to tackle price transparency. We have to tackle things like the actual prices that providers cost. We've seen that large hospital systems have been price gouging patients, have been buying up independent doctors' practices, have been merging with other hospital systems, and in a lot of urban areas, they're the only game in town, so they can charge whatever they want. You have to tackle prescription drug cost, the government monopoly system with the patents. They really restrict innovation. You have to look at, like we've talked about, patient choice. So you do have to, I would say, we don't have to overhaul the system as in starting from scratch, tearing it all down and building up something else like Medicare for all, single payer. But we do have to attack it on several different fronts, because there are a lot of problems that play into why healthcare is so expensive today.